Acting Chief Medical Officer Dr. Shawn Charles is admonishing citizens to not to rush to get tested for COVID-19 despite realizing that they may or surely have been in contact with a positive case of the deadly virus. Noting that testing, whether free to the public or paid for individuals wishing to travel, is available at all the health centers, majority of medical stations, and hospitals.
Now, when do you test? So, I was exposed to someone yesterday or the day before. When should I go get a test? Persons are advised to go out and get tested between 5 to 7 days after they were exposed to a case.
Dr. Charles says this does not apply if an individual is already displaying symptoms.
However, if you develop symptoms, you should go get tested immediately, all right, or as soon as possible.
The medical doctor impresses that rushing to get tested will hinder an individual from getting a proper result as to their status.
So if you arrived in work this morning and you spent 2-3 hours and you just learned that the person sitting next to you was diagnosed, tested positive, you don't run to get tested immediately, because if the exposure just happened, it is pointless for you to be tested immediately. All right, it takes some time for the infection to develop.
The acting CMO notes that it is important, however, to get tested so that an individual has the information which can be used to protect oneself and others. Dr. Charles says that knowing your status helps guide one's behavior, whether they are negative or positive. I am Gerard Joseph for GBN News.